Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on the coronavirus pandemic. The case numbers continue to be higher than they were a month or so ago. We do see the vaccination rates slowly moving up. We'd like to see that go faster, and as Dr. Bogan says, I think just every health professional says the key is vaccination. So if you haven't been vaccinated, we really urge you to get vaccinated, particularly with this Delta variant that is so much more contagious and so much more deadly than the original COVID that we've been dealing with a year and a half. We also, as we start to get into the schools, it's really good to see so many of the school districts and school boards are mandating to protect their children, particularly those children under the age of 12, which do not have the ability yet to get vaccinated because it has not been approved yet for the under 12-year-old population, and we want to make sure that that happens and we protect people as we enter the school year, and we want to make sure we have a successful and healthy school year for all of our children. So let me turn it over to Dr. Bogan to give her weekly update. Dr. Bogan.
Thank you, County Executive, and good afternoon. My comments today will be relatively short because most of what I have to say I have said many times before. Daily cases continue to rise. We are now seeing about 200 or so new cases a day, which places us in the high level of community transmission according to the CDC. High level of community transmission is defined as 100 or more cases per 100,000 residents over the previous 7 days. Positivity rate has increased just a small amount from last week, from 4.9% to 5.1%. Hospitalizations have also increased again this week. More people continue to get vaccinated, but not nearly as many as I'd like. About more than 5,000 residents got vaccinated last week. The CDC released 3 new morbidity and mortality weekly reports today, which provide data on vaccine effectiveness in the real-world setting, including a study from New York State, one from nursing home residents, and one from hospitalized patients. Together, these reports teach us a few important things about the virus and the vaccines. From the New York State report, we learned that the overall vaccine effectiveness against infection for all New York adults declined from about 92% pre-Delta period to about 80% during the Delta period. However, against hospitalizations, vaccine effectiveness remained very high and stable at 92 to 95% across both periods. Among nursing home residents, 2 doses of the mRNA vaccine were 75% effective against COVID-19 infections pre-Delta, but 53% during the Delta period. From the hospitalization report, we learned that vaccine effectiveness against COVID-19 associated hospitalizations was stable at about 85% during the 24 weeks following full vaccination. The vaccine effectiveness was better for people without immunocompromising conditions at about 90% across the same period. As a result of these data and emerging data from other countries, the CDC is now recommending we start offering booster vaccines in late September for those who received their second dose of an mRNA vaccine at least 8 months before. The Health Department is planning to provide booster vaccines in accordance with the CDC recommendations. More information to come as our plans develop. As the numbers increase, I again urge everyone to fight the spread of the virus by following CDC guidance. Avoid crowds, practice physical distancing indoors and outdoors, wear a properly fitting mask when indoors in public places, regardless of vaccine status, wash your hands regularly. If you get sick, get tested and stay home until you get a negative result back. Respond to the health department calls and follow the isolation and quarantine guidance. I have said all that before. I've also said this before. Please get your vaccine. Getting COVID-19 infection is risky. No one can predict how any one individual will handle the virus, both in the short term and the long term. The vaccines, on the other hand, are very safe. They not only protect you, but they protect others, including vulnerable populations such as children and the immunocompromised. If you've listened and been vaccinated, I thank you. If you haven't, well, I can be very persistent. So I'll say it again next week and the week after and the week after that. I'll keep saying it until we all start talking about COVID-19 in the past tense. We can't do that yet. COVID is clearly still very present in our community. So with that, I'll remind everyone to please be safe and be kind. I'm happy to answer questions.
Our first questions are from multiple outlets, including WESA, KDKA, and WTAE. Do you know how many of the newly reported cases are in people who are fully vaccinated? And will the health department track that information moving forward?
As I've said in the past, we do not have data, what we call on breakthrough cases for the overall county. But what we do have is limited data from those who go get tested through Curative Inc., which is the company that we are using to do our community testing. They do ask when you register for a test whether you've been vaccinated, what vaccine you've gotten, whether you're fully vaccinated, et cetera. And so from that limited data, they look at the past 14 days. And in the past 14 days, about 30% of the cases, those are people who went to be tested at a curative site. Among those, 30% are cases among people who are vaccinated fully. And we do not know about the rest of the cases. Again, we only perform a small percentage of the tests across the county.
This next question is from Public Source. Is the county considering a vaccine rule comparable to what New York City has done, requiring people to show proof of vaccination to use indoor restaurants, bars, and gyms?
At this point, we are not, but what I have seen is many organizations, including restaurants, bars, et cetera, that are requiring proof of vaccination to enter the event. I've been to many events myself in the last week or two that have required that, and I carry in my wallet and a picture of it on my phone. And I think you're going to see more and more of that as time goes on. You're seeing, obviously, what the Steelers are doing this weekend with masking, Stage AE, some of our concert venues, and other bands themselves are requiring that. So I think you're going to see more and more of that. Workplaces may do that as well, but at this point, no, we're not going to be, we're not yet considering what New York City and Philadelphia are doing.
This next question is from the Tribune Review. Are contact tracers the only mechanism for the county to determine the number of breakthrough cases, or is that data that could be imported from the state and thus made available in our Monday, Wednesday, and Friday updates?
I just want to review a couple of nomenclature. So case investigators are people who talk to cases, and those are people who have a positive test. And they can and they do ask about vaccines. So when we talk to a case, we do ask if you've been vaccinated, et cetera. However, we are not reaching everyone who's a case. Only about 50 to 60% of people are currently answering our calls. So I'm just going to remind the public, please, if the health department calls, answer our calls. We're trying to keep everyone safe and reduce the spread of the virus. The state, on the other hand, is working on merging case data files with vaccine data files. But until they do that, we don't have a way to report breakthrough cases for all of our county. Just from the data I shared at the last question about curative. But I will remind people that we know that there are increasing numbers of cases among those who are vaccinated, which is why we recommend masks for those inside. But we're still seeing very, very, very few hospitalizations among those vaccinated. So people who are getting the vaccine are very protected from severe infection, but we're seeing a higher number of people who have some symptomatic mild illness who've been vaccinated.
This next question is from the Post-Gazette and WTAE. The CDC recommended today that anyone who has gotten the Moderna or Pfizer vaccine receive a booster shot 8 months after full vaccination, which you referenced. What are the county's thoughts on this, and what steps will the county make to provide booster shots?
So yes, I did address that, I think, in my comments. And again, the data that supported that recommendation have only been released late this morning and early this afternoon, so I just had a time to briefly look through those reports. And the data do support the recommendations made by the CDC. And of course, we've always followed the CDC guidance and we'll continue to do that. Our specific plans of where, how, when we'll vaccinate boosters We haven't worked out yet since today was the recommendation, but we will. But we have lots of experience in the county giving vaccines. We gave over 100,000 vaccines during the winter through spring till now time. So we'll use all the experience we have to date to provide booster vaccines, the details of which I will provide as soon as they become available.
These next questions are from both the TRIB and WESA. Do you think upcoming festivals like Picklesburg and Little Italy Days or a parade such as the St. Patrick's Day Parade, which is scheduled for September, should go on as scheduled in light of the cancellation of the Labor Day Parade today? Have those organizers been in touch with the health department or with you? And are you concerned about cases stemming from these events? And what would you recommend they do if considering cancellation?
Well, first of all, each organization and each event is different than the others. I know, first of all, most of them are private events, including the Labor Day Parade, although, obviously the public can come and stand on the sidewalk and watch the parade. But the event itself is the Allegheny County and Fayette County Labor Council. And it's more than just a parade. It's really an all-day event with a lot of young children that are involved. Union members bring their families, their spouses, and their children and grandchildren. And it's not just a parade; it's the transportation of bringing folks here. Many of these folks are represented in counties that are an hour and sometimes longer from here, and they get on a bus. A group of them, 40, 50 people, getting on a bus for a couple of hours with young children, and then they prudently, in my mind, and the way my way of thinking, I think they made the right decision, and their members voted on it and considered, and their board and the parade planning committee decided that they were going to not do it this year. My understanding is the St. Patrick's Day folks are also going to be taking a look and deciding among themselves, and again, it's a private organization that will make some decisions. But they're again, a little bit different than the Labor Day Parade that has parties afterwards in the union halls, inside for many, many hours. Again, a lot of it's done for the children and the families, so it's a little bit different event. Picklesburg, Little Italy Days, again, people will have the free to make the decision if they wish to go, and if they're going to be in a crowd, even though they're outside, many people will be wearing masks, so they will make those decisions and see where we go. The good news is that I am pleased to see is, we have over 750,000 people now that are vaccinated, most of them fully. I think only about 68, 69,000 are partially vaccinated. So we're starting, again, to see that number climb, and people can, obviously make the judgments that they need to keep themselves healthy with masking, distancing, and other protocols that have been recommended over these last number of months.
This next question is from the Post-Gazette and WESA. Is there any update on a possible mask mandate or a return to limited capacity for entertainment venues or bars and restaurants?
Many of them are doing it on their own. Again, I don't anticipate that it'll be coming from the state or local health departments, including ours. You've seen, again, many of the concert venues who have decided, on their own. Even our own concert venues in our county parks have a vaccine section and a non-vaccine section where people can, feel that they can go to the places that make them feel safe. Bars and restaurants, again, many of them are making their own decisions regarding masking, regarding distancing, regarding the things that they're doing with showing vaccine cards, and we'll continue to monitor. The good news is that while the cases have stabilized, at a level that's a little higher than we wanted to see, but they're not going up over the last week or so. And we continue to see the hospitalization numbers and the fatality numbers, thankfully, remain low. So we'll continue to monitor all those factors and where things go with variants and other things as we go along.
This next set of questions is from WESA. Would you like to see more medical systems mandate the COVID vaccine as a condition of employment, or perhaps create vaccinate or test policies?
Yes, and I think we've talked about that in many organizations, health as well as other organizations are beginning to do that. We certainly made that announcement a week or so ago that all new county hires must be vaccinated. The city of Pittsburgh did the same, and other organizations have done the same thing. Those that aren't vaccinated are required to wear their masks the entire time at work. and go through constant and rigorous testing. And I think you're seeing the same thing at some of our healthcare facilities. Certainly the universities have been doing very similar operations as well as requiring vaccination requirements among staff and students. And I think, again, you're seeing this around the country. You're probably going to see more and more of this, and some of it will come into effect when the emergency use authorization goes away and it becomes fully approved, both Moderna, Pfizer, and J&J.
In reference to the emergency use authorization, will the county strengthen its employee COVID vaccine policy once the vaccines receive full FDA approval?
That's something we'll certainly take a look at. Again, we'll kind of be following CDC recommendations, but we're certainly going to take a look at as that changes. And certainly, hopefully, that children under the age of 12 then also become eligible. That could have some changes in the way organizations, schools, et cetera, continue to do things. So we'll continue to monitor it as we have continued since last March, and in consultation with Dr. Bogan and her staff, and all the medical organizations that we she and her team talk to on a constant basis. We'll continue to monitor that.
For the last couple of weeks, case numbers seem to be staying between 150 and 200 per day. Does this indicate a plateau?
I think it's really too soon to say, and we'll just have to wait and see.
This next question is from the Post-Gazette. Is there anything in the current data on cases or hospitalizations among kids in the county that leads you to believe that the Delta variant is more infectious for children and or causes more severe illness?
I think I answered that last week, and my response is the same. What we're seeing is more cases overall, and when you have more cases, you're going to have a certain percentage of those cases that get hospitalized among children. Again, there hasn't been clear evidence that there's more severe disease from Delta. It's just more easily spread, more cases results in more hospitalizations.
Given the rising case numbers among children in the county, what do you think about the sometimes harsh criticisms that school board members and superintendents are hearing at public meetings recently from parents opposed to masking mandates?
I don't think I can be any clearer than I have been over the last many weeks, that I strongly recommend that all of our schools follow the CDC recommendations to follow universal masking in K through 12 schools and child care programs.
And this final question, also from the Post-Gazette, do you know roughly what percentage of children up to 18 years old who are testing positive are vaccinated and unvaccinated in the county?
I do not have any information on that I can share. Thanks.
And that was the final question. If there are any closing remarks.
Well, I want to again thank Dr. Bogan and her team for the continued work they've done for this last year and a half. As things change, and it's almost week to week, month to month, you're expecting a certain outcome, and sometimes it goes that way, and sometimes it throws us a curveball, so to speak. And they continue to monitor it with testing, with data, with as much information, working with our partners as we can do that. I think she said it very clearly about the school districts. As we enter school in the next couple of weeks, we strongly urge following the CDC guidelines for the school districts. We have 43 of them. I'm going to give a shout out to a number of them who have already decided that they're going to have a mask mandate to protect their children, particularly those children under the age of 12. And that's Allegheny Valley, Avonworth, Carlinton, Clairton, East Allegheny, Fox Chapel, Gateway, Hampton, Keystone Oaks, Montour, Moon Area, Mount Lebanon, North Allegheny, North Hills, Northgate, Pine Richland, City of Pittsburgh, Riverview, Shaler area, South Fayette, West Mifflin, Wilkinsburg, Woodland Hills, and also the Catholic Diocese announced yesterday that all of their students also will be required the mask mandate. I know a number of the school districts, some are, I think Penn Hills is having a meeting tonight, and others will over the next couple of days and the next week. We're certainly encouraging those school districts, particularly the underage 12 part, the K through, I guess, 6th grade or so, to make sure that they protect those children. So let's stay safe. Let's continue to get vaccinated. That's going to be our best path out of this. For those of us that have been vaccinated, certainly gives us a sense of relief and a sense of freedom that when we go somewhere, we're not at risk for getting this very, very deadly disease. So everybody stay safe, and we'll talk to you next week.
Our next regularly scheduled briefing is Wednesday, August 25th at 4 p.m. Thank you for joining us.